So Intermountain Healthcare has a biorepository. Can you tell me a little bit about that and how it will impact patients?
Yeah, so the Intermountain Biorepository is a facility in which we've been storing tissue samples for about 40 years now. And so
Wow.
we have approximately 4 million collected samples. These are organized in a fashion in which they're readily available to researchers both within Intermountain and other institutions. And the power that the Intermountain Biorepository has is not only the number of samples that are there, but ultimately the fact that they're centrally located, they're easily accessible, and that they're tied to important medical record information. And so we're able to relate certain types of samples with the type of treatment that they received or the kinds of outcomes that they had. And so we can really take advantage of that. And a way in which we are doing that is we're doing whole genome sequencing on a large portion of these samples, and then we're identifying certain types of outcomes that we're interested in. So whether patients recurred or not or responded really well to treatment, we want to be able to identify genomically why that is, and the biorepository really helps facilitate that by allowing us to use those samples however we think is best.
Now, are these samples, are they past patients, deceased patients, and then we're researching for current and future patients? Is that correct?
Yeah, exactly. So it's composed of largely patients that have passed on, and these are historical samples, for example. But we have standard protocols in place to continue collecting specimens ongoing. And so 4 million samples right now and growing.
Wow.
Yeah. So another, really powerful tool that we have to be able to determine from the biorepository is the ability to understand pharmacogenomic properties. So this is the ability for patients to respond differently to different types of treatment, even though they're diagnosed with the same type of cancer, for example. And so this is a big question that we have today, is why are patients responding differently than others? And so being able to do this whole genome sequencing, for example, allows us to answer that type of question. And ultimately, find a very unique profile for a very unique patient. This I believe is really precision genomics, or precision medicine, so to say, truly in its true form.
So you're learning how individually to treat a patient rather than a blanket approach, as has been in the past.
Yeah, exactly. Yeah, the genomic profile really will set them apart from anybody else, and therefore we're able to really find out specifically why they responded a certain way. What was unique about their genome that caused them to do that.
Great.